In this video section, we will discuss about the surgical anatomy of anus and anal canal. Anal canal lie below the pelvic diaphragm and ends at the anus. Anal canal surrounded by the internal anal sphincter and external anal sphincter. Internal anal sphincter is the continuation of the smooth muscle from the rectum with the involuntary control which is via the autonomic nerves. External anal sphincter striated muscle under the voluntary control via the pudendal nerve. Remember, in the internal anal sphincter, there is the involuntary control, which is by the autonomic nerves. In the external anal sphincter, striated muscles, and it's under the voluntary control, which is the pudendal nerve. Internal and external sphincters are separated from each other by the intersphincter plane, which is also known as the Wilton-Sweet line. The anal canal is divided into upper two-thirds and the lower one-third by pectinate, which is also known as the dentate line. Dentate line developmentally represent the hindgut, which is the proxium junction, and the upper anal canal, also known as the visceral portion, and it consists of upper two-thirds of the canal as we discussed above, and it consists of the longitudinal folds of the mucosa called the anal columns of the Morgagni, anal valves, and the anal sinuses. Epithelium, if we talk about the epithelium of the upper anal canal, its epithelium is simple columnar cuboidal epithelium, and its venous drainage is the portal venous system via the superior rectal vein, and lymphatic drainage is by the internal iliac nodes, and sensory supply of the upper anal canal is fibers from the pelvic plexus. Now, lower anal canal, which is also known as the somatic portion. So remember, upper anal canal is also known as the visceral portion, and the lower anal canal is also known as the somatic portion, which is consist of lower one-third of the canal as we discussed above. It extends from the pectinate line to the anal verge, like the point at which the perianal skin begins. And if we talk about the epithelium of the lower anal canal, it's stratified squamous epithelium, and the venous drainage of the lower uh, anal canal is the caval system via the middle and the inferior rectal veins, and lymphatic drainage is by the superficial inguinal nodes. As we discussed that upper anal canal lymphatic drainage is the internal iliac nodes, but the lower anal canal the lymphatic drainage is the superficial inguinal nodes. And then sensory supply here is the somatic nerve fibers of the pudendal nerve, which are very sensitive. This is all about the anus and anal canal surgical anatomy. Thank you.